Hello, everybody. This is Cassie Story, Director of Nutrition for Bariatric Advantage, and I'm excited to welcome back our presenter today, Dr. Paul Davidson. Today, he will host a follow-up webinar to his Strengthen Your Practice by Running Bariatric Support Group. This webinar is titled 6 Tips for Starting and Running Successful Bariatric Support Groups. Dr. Davidson serves as the Director of Behavioral Services for the Center of Metabolic and Bariatric Surgery at Brigham and Women's Hospital in Boston and is an instructor at Harvard Medical School. He earned his PhD in clinical psychology at Brigham Young University. He is a member of the American Society of Metabolic and Bariatric Surgery and was elected to the Integrated Health Executive Council this past year. Dr. Davidson speaks internationally about bariatric topics and heads the behavioral section of the annual Bariatric Summit. He is an associate editor for the Obesity Surgery Journal and a reviewer for Surgery for Obesity and Related Disorders, Clinical Obesity, and the International Journal of Obesity. If you haven't followed him yet on Twitter, go ahead and give him a follow. He can be found at Paul Davidson, PhD. He helps to head the hashtag OBSM chats, which focus on topics related to bariatrics, obesity, diabetes, psychology, exercise, and motivation. Before we begin, we wanted to cover a few housekeeping items. At the bottom of your screen are multiple application widgets. They look like little icons. All the widgets are resizable and movable, so feel free to move them around to get the most out of your desktop space. We will be addressing questions at the end of the webinar, so please submit them through the Q&A box during the course of the presentation, and we will try to answer these at the end, but some may be answered later via email. A copy of today's slide deck is available in the resource list. For the best viewing experience, we recommend using a wired internet connection and closing any programs or browser sessions running in the background that could cause issues. Webinars are bandwidth intensive, so closing any unnecessary browser tabs will help you conserve your bandwidth. The webcast is being streamed through your computer, so there is no dial-in number. For the best audio quality, please make sure your computer speakers or headset are turned on and the volume is up so that you can hear the presenter. Some networks cause slides to advance more slowly than others, so logging off your VPN is recommended. If your slides are behind, pushing F5 on your keyboard will refresh the page. You can find additional answers to some common technical issues located in the Help widget at the bottom of your screen. An on-demand version of the webcast will be available approximately 1 day after the webcast and can be accessed using the same audience link that was sent to you earlier. All right, now that we've got all that housekeeping out of the way, please join me in welcoming back Dr. Paul Davidson, the man, the myth, the legend himself. We are so excited and grateful that he put together this awesome webinar for us today, and let's go ahead and get started.
Cassie, thank you so much for the very kind introduction. I do not feel worthy, but it's great to be able to do this with you. And I do welcome every single one of you to the webinar, and I want to give a special shout out to those of you who attended last week as well. I hope, last week we talked about why would you want to be doing these bariatric support groups in your program. Today we're going to be talking about the hows. And what we want to focus on is the savvy of running these. And so I'm going to go point by point. These are the top 6 tips. So number 1, give patients what they want. Number 2, focus on interesting topics. Number 3, watch out for the things that are going to stifle communication in a group. Number 4, be able to address the most common problems that come up in running a group. Number 5, find ways to engage people for the long term. And number 6, remember the details. There are a number of tips I'm going to give you that will help enhance the success of running a group. Give patients what they want. That should not come as a big surprise. If you give people what they want, they're going to come back. If you don't satisfy them, you're not going to be seeing them very much. And I do want to mention quickly that there is a significant drop-off in attendance for bariatric patients after about 1 year. Most people are pretty good about coming to their follow-up appointments in the beginning. However, after 1 year, we see less, and part of it is because they're not getting their needs met. support group is one of those ways you can all help your patients get what they want. So what they say they want, so if you take a look at surveys, number one, patients want information. They are always looking for the latest information about dietary suggestions, anything related to activity, anything that they should be doing in regards to body image or how to handle medical issues that come up after surgery. Number two, hints for success from others. This is why the group format is so powerful. It is the one place in which they're able to get information from others. Now, many times people look online to social media as a way to do this, but there is something magical about having people in a room together or at least online together for a discussion of specific issues rather than a more general bariatric website, which a lot of people do go to. People learn from one another, and it's also an opportunity to get feelings out. Many times we have individuals who have kept things to themselves for a long time, and now they finally have a chance with people who they feel understand them to be able to express themselves. And the notion of sharing this with others makes them feel much more normal about what they're going through and not alone, because oftentimes bariatric patients aren't surrounded by bariatric patients. They're surrounded by individuals who haven't and may not understand. So it's also about creating friendships, relationships, and so on. And, most people say they are looking for somebody who can help lead the group, who can share different topics, who can share research, who can share experience, who can give them a sense of security that this is somebody who knows a good deal about the area, and listening to them is going to help them to succeed, at a greater extent. Also, revisiting concepts to reinforce knowledge. So everyone coming to a bariatric program, and I'm sure all of you who have been involved with this, have taught people what they're going to need to do. But the problem is, oftentimes our patients feel barraged. There's so much information that gets presented that it's overwhelming, and it takes time to unpack. And a group offers the opportunity over a period of years to reinforce and revisit those concepts. And even if somebody gets it in the beginning, they may lose sight of it 5 years, 10 years down the road. I have group members who come after 20 years, and they say, boy, they're still learning from this. And also that ability to come regularly helps them stay connected to the program. And as we discussed last week, for those of you who are in attendance, individuals who go to more bariatric support groups are more likely to go to more parts of the program in general for follow-up. So number two, okay, you want to choose an engaging group topic. So we talked about giving people what they want. Now we talk about group topics. And so, again, now we're taking a look at the notion of varying topics. And this is, again, based out of research I presented last time from a review study by Livitz. People want varied topics. They don't want to hear the same thing again and again. It's a good idea to try to come up with a wide variety of different topics. I'm going to suggest a number in just a few minutes. You want to make things as broadly appealing as possible, but there are some times where you want to pitch something to a very specific group, to people who are newly out of surgery, to individuals who may have eating disorder issues after surgery, to individuals who may have substance issues, individuals who want to deal with body contouring, plastic surgery. That's not a talk necessarily for somebody who's 3 months out, but boy, is it a talk for somebody who's a year and a half out. But most of the other things regarding hydration, and we'll talk about medical issues and behavior, would apply to most anybody. Using content experts whenever possible, we'll speak to that. Also, content-based themes are really good. So I'll tell you, this year in our program, our basic theme is back on track. So every other major support group we offer has a back on track topic, which can be getting back on track with, eating, back on track with exercise, back on track with relations, back on track with regards to self-esteem, and so on. And that theme works really well because once somebody gets hooked into one of them, they want the rest. And also planning special events. I'll come up on the number of those soon. So when we talk about some of the areas you can focus on, physical health is always something of interest. So how do you deal with issues of medications? Because oftentimes medications are changing after surgery. It's great to invite in medical experts. So it can be MDs, obesity medicine specialists, surgeons, nurse practitioners, primary care docs, nurses, dietitians, and so on. Everybody loves to have a specialist come in. You know, you may have a group helping individuals understand what kind of signs might mean they're developing a problem, especially for things like dehydration, hypoglycemia, and so on, especially for dietitians. These are areas where you have great expertise and can share that. Dealing with pregnancy after surgery, that's very much of interest, especially to younger women. Research findings related to health and surgery, nutrient absorption, how that shifts after surgery, hormonal, bacterial changes, physical activity and exercise, so many areas in physical health. Emotional also tends to be a very significant area. Many of us talk about mindfulness, and oftentimes that may get forgotten. So it's great to discuss mindfulness, in terms of eating choice, the ways people eat, taking your time. We can get into relaxation training and so on, changing body image. You know, one of the things that we tend to see is that when people lose a great deal of weight, the mind lags what the body has already done. And so even though somebody's lost a lot of weight, they still see themselves as much larger, or they may bemoan the fact that now they have excess skin. And so that's where having a plastic surgeon is often very useful. We use patient testimonials as a way to help individuals get more motivated to stay involved with the program and to feel like, this is somebody who I may wish to follow, and to help them with their own journey. Image makeovers, these are some of the special events. You know, I'll mention that later, too, and dealing with addictive behaviors, because there is an increased risk of especially alcohol abuse following bariatric surgery. We thought that it was primarily with gastric bypass, but now with more data, we know that we see this with the sleeve gastrectomy as well. So being able to discuss that is very valuable, and recognizing non-scale victories. As I tell people, the scale is useful in the beginning, but after a little while, you really start to focus on the non-scale issues. So it's the ability to dance again, to be able to go on an amusement park ride, to be able to bend over and tie your shoelaces without being out of breath, you know, being able to go up a flight of stairs, being able to get on the floor and play with your child or your grandchild. Helping people focus on that goes a long way towards people feeling more successful. Nutrition, especially of interest to a lot of folks who hopefully are attending the webinar. So, you know, it's amazing. We have people all the time who forget how to read nutritional labels. And actually, as many of you know, nutritional labels have changed recently. So helping people with that, how to deal with maintenance based on the kind of foods that people should be eating. And, you know, sometimes people will be coming in with gluten sensitivities or diabetes or other situations that require specialized discussion, how to develop sensible eating habits and alternatives. I'm a big one for helping people find sensible alternatives to what they already do. So if I have somebody who loves ice cream, I try to help work with them to find substitutes. So there are brands of ice cream-like products now that are high protein, lower in calories. They can do, I know there are websites you can turn to, that have recipes to do this, how to deal with creative meal preparation. I know we've done some of this where we said, you know, you have 5 ingredients, we're going to make a 3-course meal. We've done stuff like this using just a microwave, because we're assuming these are things people may have access to. Group trip to a supermarket with a dietitian. We've done this. It works great. Protein, vitamin, supplement taste testing. This works beautifully. And I know the sponsor of this webinar, Bariatric Advantage, has been very, very kind to offer product as well as other companies to allow people to sample that before, usually before surgery. Potlucks, recipe sharing, cooking demos, all these kind of things are really loved by patients, creative ways to use groups. So relational health. So I think it's important to be able to discuss cultural issues. I happen to live and work in a place where there's a large Hispanic population, so oftentimes we will deal with issues related specifically to Hispanic culture, food, and so on, dealing with family dynamics. Now, we all know how challenging this can be when somebody, you know, has to prepare a meal for themselves, but maybe they have children in the household who have very finicky, you know, kind of appetites, or partners, spouses, or going out to eat with others, and family members when you're having a family celebration or holiday, dealing with that. Sexuality, something that I've had some very, very great groups on, in which people are really interested in some of the shifts that take place, and they notice that elements of sexuality improve, and we have strong data to suggest, especially for women, there are shifts in hormonal levels that lead to greater satisfaction. Sometimes people want a safe place to talk about this. Dealing with the strains on relationships, I think I already mentioned that. Involving and educated support for people. So sometimes we'll do groups that are designed in which we encourage people to bring their support people in to try to teach them how they can be more helpful to the patient. And lastly, impacts on socializing, because as we all know, just as somebody who has an issue with alcohol tends to like that, has drinking buddies. People who have had issues with food often have eating buddies. And most of us like to go out to eat with others. After surgery, that can be quite a shift, and so we need to deal with that. Also, dating can be more challenging in other ways. Social events, I mentioned very quickly. So, among those include having makeovers, and oftentimes it's possible to find a makeup artist in the area, or you may even have a patient who excels in as an esthetician and can help do makeup or a fashion show. Doing something active, group hikes and so on. This is a wonderful way to spend a group, because when people walk, they like to talk. Clothing exchanges, as people are going down in size, we tend to see that, getting rid of some of those larger clothes is valuable, and picking up some things that may fit them work well. So talking about dressing, how to dress now with a new body, and exchanging works really well. Visiting a gym and or trying to find a program in your area who is willing to come to you. So we have had exercise physiologists come to our program and run exercise sessions as part of our support group. Doing a group outing, such as a picnic or so, or going to a ball game or playing a ball game works well, and something like that works especially well if you can have like patients and staff together. They can be on the same team or opposite sides, but it really brings about camaraderie. So, tip 3, beware of communication killers. So these are the key factors. These are the 7 deadly sins, if you want to put it, of running a support group. And so these are the things I want you to focus on. If you avoid these, chances are you're going to do pretty well with running your group. So we'll start off with interrupting. That when somebody is trying to speak in a group, it is really wise to allow them to finish saying what they're going to say. Oftentimes we do this in conversation where we're thinking ahead of how we want to respond before letting somebody finish. So interrupting makes a person feel invalidated. Going clockwise, patronizing, I know just how you feel. Fact is, none of us know just how somebody else feels. We haven't had the same experience. You may be able to relate to it, but the second you say, I know just how you feel, it comes off as being disingenuous. So we want to help people understand that, I've experienced things like this, but I have no idea what this is like for you. You have a unique set of circumstances. Please tell us what it's been like for you. Why questions. People don't like why questions. Why? I don't know. It makes them defensive. They feel, kind of put on the spot. Why did you say this? Why did you do that? We do much better with asking questions that are like, how did this affect you? And what did you do in this case? And where were you at the time? And so on. So avoiding why questions often opens discussion. Using why questions often shuts it down. False reassurance, very much like the patronizing. You don't want to let people know that, hey, everything's going to be fine, when you don't know if it's going to be fine. You have to allow individuals the freedom to feel what they're going through. Giving unsolicited advice. If somebody's coming to talk to you about something specific, focus on that. And if they want help, if they want advice, give it. If they're really not looking, they just want to vent, then that's what you want to do. I think as a male, I and others are often prone to sometimes giving advice when somebody just wants to hear and be heard out. So I highly recommend that. Trying to force someone to talk, this is a voluntary process. Nobody has to speak. We do encourage, especially if somebody's more silent, somebody to speak, but can't force them. And last but not least, preaching. We don't want to get in that position, because this is about facilitating, not dominating, which I will mention again in a moment. So typical group problems. So monopolizing is when somebody is kind of overtaking the group. And in that case, I think part of what you want to do is you want to hear what they have to say, summarize, and then say, okay, Jane, if I heard you right, you were saying this. Is there anybody else who feels this way? Or, Jane, you made a really clear case. We do have other things we need to cover today, but thank you for bringing it up, and we'll come back to this. Somebody who's silent. It's always good to check on, when there's silence in the group, see if you have missed something or if something is really bothering somebody and just checking in. Emotionality is fine. If somebody becomes tearful, upset, or laughing, it can be the other way, or even angry, upset, it's okay to allow some of that to flow. It encourages honest communication within the support group. Conflict is the same way. Not necessarily a bad thing. We have to show that we allow for everybody to have a view, an opinion, and that there's room for everybody in the group. Leader dominance, this should be obvious. The goal is to facilitate. You should not be doing all the talking. If you are, you should come up with a quick question and then back off. And dealing with interruptions, we want to encourage people to be civil, and your job as the leader is to help ensure that somebody gets to be heard thoroughly. So, when you're dealing with problems, number one, get to know who's likely to cause it. You may need to speak them outside of the group just a little bit. Determine what the unexpressed need is. Generally, when there's a problematic situation, there's something somebody has to kind of get off their mind and hasn't been able to. If you can figure out what that is, what that emotion is, that experience, chances are you can move on. Number three, what are the group needs? The group needs always supersede the individual. This is one of those times. So what does the group need? And the group always needs safety. So that should be number one. That is why I say number four, focus on group safety and integrity. If anybody is becoming in any way disruptive or causing a problem, it's your job as the group leader to kind of say, Stephen, I understand that you're upset about this, but right now is not the time to get into this. I'm happy to talk with you afterwards, but this is not the time or the space. Number five, let the group be part of the solution. Well, what are the rest of you thinking about what Stephen's going through or something along that line? Let them help solve the problem. You have mature adults in there. Okay, how to keep people engaged long term? Well, there are different studies that look at different things. And number one, great UK studies show that those who are more interested in the support group, they feel like they're having a harder time keeping it off. These are people who aren't as happy with the result because of the excess skin is one of the reasons. And those who have had struggles with the return to their normal life, those people want to go to group more. Support, also is looked at in terms of how do we get the education from the experts. I know we talked about that last week. Getting moral support, not, again, feeling alone, feeling as if your experience is normalized and getting support from others, and finding ways to maintain contact with specialists. That's crucial. Also, topical variety, I've mentioned that, using newly emerging technology. So in this case, this is where it is useful to use social media, some of the online groups that we spoke about. Encourage active participation, and one of the ways you're going to do that is by you being active as well. It's very valuable for individuals to make sure that you say something about your own experience. Special events, we've gone over a number of those. Address destabilizing group dynamics rapidly. Do not sit on those. Work within the group size. I mentioned that when you have a smaller group, usually have one, facilitator. But if you have a really large group, we're starting to get to 30, 40, 50. You may want to break it into two. Accommodations, we've talked about that in the beginning, and surveys are also useful to help understand what your patients are looking for. Sixth, last main thing is look at the details. So this should be clear to those of you who paid attention. So you want to assert leadership early. One of the ways you do it is by introducing yourself and have everybody introduce themselves in the group. You've just taken control. You say, we're going to have an agenda. I'm going to present an article for you. Review the group contract. We talked about that in the beginning. Member introductions, group routines, group agenda items. Come prepared with something to share. Always have something prepared to share. Facilitate, as I said, don't dominate. So if you're fairly quiet in a group, that means the group is going well. Always want to give somebody something new that they learn every single time they come, which is why I personally choose some piece of data or research to share. Creating a supportive culture is crucial. When I first went into a program I'm working in, the program I'm working in now, the culture was not that supportive, and so it meant a kind of redo and help explain that we are here to help one another. Needless to say, our culture is very supportive now with our groups. Make sure any problems are addressed rapidly. Don't let them sit. follow the natural flow. Sometimes you may have something you want to discuss, but they're interested in something else. It's fine. Move in the direction that the people want. That is their group. And it's okay to not know all the answers. I always talk to people if I don't know the answer, and I'm honest about it. I say a couple of other tips. Laughter and tears strengthen bonds. You want the group to become the expert. If somebody's silent, check in, see how they're doing. Try to find whatever positive lessons they can learn from the day and recognize that your own sharing encourages others to do the same. Passion, enjoyment are contagious, and most of all, have fun. If you're enjoying yourself, the others will too. So I really so much appreciate your attending the webinar today. I thank you for your kind attention. And I showed this slide last time because I'm a big believer in this. If you want to go fast, go alone. If you want to go far, go together. It's now time to take some questions. I, again, thank you for your attention. So we are live with questions now, and I want to thank you again just for coming on board. I thank those of you who came last week and this week. I hope the two pieces really give you some great information to bring back to your programs, not only how to now how to do this, but also why to do this. So take a few questions. We don't have a lot of time. So this came by, what type of professional do you have handled the support groups for the sexuality or strains on relationships? So we are very fortunate in that we have a couple of psychologists in our program, which is really wonderful. Some people have social workers, or there are sometimes, if you don't have them, you may have people in the community, but we also have very talented physician assistants. We've had dietitians do a few of these things, but usually you're trying to find a mental health professional if you can get one. Again, if you don't have one in your program, seek one out in the local community who might maybe do some of your evaluations or something along that line. But there are a lot of people who are quite capable, especially talking about strains on relationships. I don't think you need any special talent there. I think you just need to open the floor to people discuss. There's also a question, do you have any kind of release sign in doing the hiking or the ball game for liability issues? Great question. The answer is no. We haven't done that, but we've been lucky. We let people know that they're choosing to do this on their own, but we have not had them sign it. Actually, now that I think about it, I think that's actually a wonderful suggestion to think about. Next question, how do you organize a makeover? So in order to organize a makeover, a couple of things I think you want to take a look at. So it's wonderful publicity for people who are makeup artists, people who do hair. One of the things that I think happens, and people who sell clothing. So we go out to the community. We actually have had people in our group from our patients who are quite good at some of these things, who have volunteered their time. But we've gone out to local hair salons and makeup artists. I don't know these things, but we have women in our group who know these in our program who know that, and ask them, if they would be willing to do that. We publicize it. We get the name of their business out, and what we're trying to do is help individuals, especially as they're having changes that have taken place both to their face and to their bodies, start to learn how do I maximize my look? I know, so we, getting in makeup artists, give them a few tips. People who are hairstylists, often they will come and they'll say, you may want to try do this, wear your hair a little bit differently, and they give them a few suggestions. And usually you have, a couple of people who are your your examples. They'll volunteer and they'll do some work on that individual. I know programs who have also been able to get local places, including big names like I think Macy's or Neiman Marcus, who are willing to allow some use of clothing to help think about outfitting. And we also have talked about having people who are in the fashion business and who know how to do clothes well come and give tips about how to dress differently when you are, lighter than you used to be. Okay, let's see. For just getting started with a support group, what do you suggest in terms of topics? I think if you're just getting started, key thing would be to survey people who are in your program and ask them what they would like. These can be, done on Facebook. These can be done with little, kind of question cards that you would have in the office. I think there are a certain number that are always going to be popular. One will always be, how do I address weight regain? Everyone wants to know about that from a behavioral perspective, also from a nutrition perspective. How do I get, different ways to get my protein in, and how do you come up with quick meals? Those are always happy. The relational issues are huge. So you go on that, you'll be fine. But I suggest surveying your people. Sadly, time is already blown. I know this webinar was a little longer than last week, so that we didn't have as much Q&A time. But again, I want to thank each and every one of you for attending. I want to thank Bariatric Advantage for kindly being willing to host this. I hope you got something out of it. I believe you will be able to access it afterwards, share it, and if it gets repeated, I hope you'll encourage your colleagues to try this again. Quick question. Experience broadcasting support group meetings? Yes. We do it on Facebook Live sometimes, and we do not have any specific liability issues that we've run into. There was a private closed group, so it's our patients, we let everybody know. We don't mention patient names during Facebook Live. The HIPAA and the online groups, we don't give names, and actually when we do film, we film from the back and we don't show people's fronts. Okay. Fortunately, I do need to stop, but again, thank you all so very much for your participation, for the questions. I wish you luck with your groups and hope I'll have a chance to meet you in the future. All the best. Thanks.